This is Selma Schimmel with the Group Room, and we are at the 33rd annual meeting, the San Antonio Breast Cancer Symposium, obviously in San Antonio, Texas, where we have the opportunity to speak with physicians, key opinion leaders from all over the country, but now we're going to be joined by a physician from Europe, and we are with Professor Hans-Joerg Senn. How do you do? And welcome.
I'm doing fine, thank you.
You have a very important role in Europe. You're the chairman of the St. Gallen Oncology Conference, which is upcoming shortly following the San Antonio meeting. You're also the director of Tumor and Breast Center at the ZeTuP Institute in St. Gallen, Switzerland. And your specialty then is breast oncology?
I'm actually a medical oncologist by formation, and since more than 25 years I'm primarily involved in breast cancer research, clinical research, that is research on patients, trying to find out new and more effective therapies. And since about 10 years, when we opened this new cancer and breast center in St. Gallen, Switzerland, I got more and more involved in prevention of breast cancer.
Is the element of prevention one of the big distinctions between the meeting focuses here and your meeting in Europe?
To some extent, yes, because you have to be careful. Prevention can be done at various levels. There is primary prevention, which is prevention of disease not occurring. There is secondary prevention, which means early diagnosis and better outcome by earlier therapy. And there is so-called tertiary prevention, once you had the disease, in preventing relapse. That's what we call adjuvant or multimodal therapy. And in the first and in the third level, especially in adjuvant treatment, we are greatly involved in St. Gallen. And there is a distinction between these meetings, as we center exclusively in the primary treatment stage, not in breast cancer relapsing advanced disease, as it is occurring here in San Antonio or at other breast cancer meetings around the world.
Professor Senn, are there, in your opinion, philosophic and practical clinical differences when it comes to the treatment and how we approach breast cancer in the US versus Europe?
Well, I would say there have been in the past, but I think it's slightly equalizing more and more as we are getting used since about 10-15 years to work in common treatment groups, big groups, breast international groups, where American, Canadian, and even South American breast cancer trial groups are uniting with European groups and also sometimes Asian. So we are getting closer and closer together.
Yeah, and I think this is a very important point for patients to understand, is the global nature of clinical trials and research. And I don't know if you know this, I am a breast cancer survivor, having had it in my 20s some time ago. And I remember that my protocol came from Professor Gianni Bonadonna's group at that time, the old CMF protocol, and Milan being one of the centers of breast cancer research. So the influence of breast cancer research from Europe is very significant.
Yes, these were very interesting times. I know Gianni Bonadonna very well. He's one of my best friends. And with him together, starting these Italian first CMF adjuvant trials in Milano, we started the first Swiss adjuvant breast cancer trials in St. Gallen. And together with Bernie Fisher from Pittsburgh, we were a trio that actually set up the St. Gallen breast cancer meetings, because we all were doing at the same time the first studies of this kind in our geographical areas of the world, getting different results. And this was kind of intriguing. So we then got together, and it was in 1978, that's a long time ago, nearly 33 years ago, we did the first meeting where we tried to get the point why these results were differing, what did we do different, how did we select our patients, were our treatments different? And that was the start of this whole meeting series.
Professor Senn, what are some of the real differences in the types of discussions and what's being presented at the San Antonio Breast Cancer Symposium versus what you'll be focusing on at the St. Gallen Breast Cancer Conference?
The San Antonio meeting is a general breast cancer meeting, somehow touching every aspect of breast cancer from the beginning, from prevention or early detection to the end, to palliative or advanced disease treatments. Ours is only centering on the phase of primary treatment. It's called primary treatment of early breast cancer. So we are centering on the primary curative approach to actually cure the women with this disease in the first attack. That means surgery, pre or post-surgical chemotherapy or endocrine therapy or immunotherapy today with these targeted agents. And it does not cover all these problems that come later on if you have a relapse or even advanced and late-stage disease. That's a very great difference. And another difference is that we do not open the meeting to everybody to present a little piece of work like all these kind of abstracts, and you can see the posters by hundreds here with provisional results of young investigators. We have only invited speakers, the top shots, the big experts of the world. And one thing we do, I think we are the only large breast cancer meeting in the world which is doing this. We finally close the meeting with an international treatment consensus worked out by a panel of about 40 of the best experts worldwide from over here, from the States, from Canada, from Australia, from Europe, from Japan and from China. Everybody who is really doing substantial work in curing breast cancer. And this St. Gallen consensus is then published very prominently in Annals of Oncology and followed in many countries until the next biannual meeting comes, and this consensus has to be updated. So we are going to update in March 2011 the consensus of 2009. This is a difference because this is not done here. See, nobody is actually for the ordinary general oncologist or treatment-oriented internist or gynecologist or surgeon. Nobody is really putting things together. Somebody has to do a consensus on how to optimally treat breast cancer today. That's what we are trying to do.
So I have a final question. What excites you most as you look at the future of breast cancer and coming to this meeting, preparing for your meeting? You've been practicing medical oncology for some time now, so what really has you the most feeling hopeful and the promise for the future?
Well, I would not have to be an internist if I would not say that I think cure is finally coming from medications. You see, the surgeons since decades are not able to cure breast cancer. They cannot prevent metastasis and dissemination. Neither can the radio-oncologists. And you will not settle the problem of prevention because, as we spoke about, it is not just accepted. So the only cure finally, or at least more cure, which can come is by more intelligent drugs, targeted therapies for all the different types of breast cancer that the lady can develop, because there is not one disease, breast cancer. There are many diseases with biological differences which we have to find out and treat accordingly.
Thank you, Professor Hans-Joerg Senn, Chairman of the upcoming St. Gallen Oncology Conference and also the Director of Tumor and Breast Cancer, the Center in ZeTuP, St. Gallen, Switzerland.